Hello, everyone. I'm Dr. Amy He. I'm an associate professor at the Graduate School of Social Work at the University of Denver. I'm really excited to talk with you all today about moral distress. So let's dive on in. We'll cover three main things today. First is I will share an understanding of what constitutes as moral distress. Next we'll talk about what distinguishes moral distress from other terms like moral injury, which may be terms you're hearing, right? And the third is how do you address moral distress? Some practical next steps after our conversation. So what is moral distress? So moral distress originates from the nursing and healthcare literature and the healthcare field, and really talks about how moral distress occurs when a worker knows the professionally ethical and appropriate action to take, but they can't take it because of constraints in their everyday work that compromises then their professional integrity. And these can be constraints for myself when I was a child welfare worker, really wanting to refer families to court mandated services towards family reunification. But because, for example, substance use treatments that are not available, lack of transportation, all these constraints that didn't allow me then to help families get the services and help that they need, contributed to, for myself, experiences of moral distress. And moral distress then can be at the unit level, right? So fearing that doing the right thing because you fear retribution for speaking out. It could be at the systems level, right? Which is what I shared earlier around maybe lack of resources, oppressive policies, or social political factors that doesn't allow you to do the work that you want to, or to give families the help they need because of these constraints. So that's a general definition of moral distress. What is it then are indications of moral distress, right? So feelings of emotional or psychological imbalance, frustration, anxiety, guilt, and for many people, a sense of powerlessness. And how that impacts child welfare workers and social workers overall is can be associated with feelings of burnout, client disengagement, compassion fatigue, a feeling of decreased capacity for delivering services. And ultimately, for some people, it results in leaving the profession altogether. And what is then specifically right now, right, for child welfare? Really current example I've been hearing from talking to workers in the community is child welfare workers really feeling unable to provide necessary resources and supports to immigrant families because sometimes due to the family's residential status or the fear of immigration and custom enforcement, ICE raids. This is then contributing to workers feeling more distress, feelings of helplessness and conflict when they feel that they can't help families the way that they need to or get services to families, especially to historically marginalized groups. In this example, would be immigrant communities. So that's a current example that I'm hearing in the community. So moral distress in the context of child welfare work. So for child welfare, many folks are social workers and they're trained in social work and have a code of ethics that they follow from social work. So, which is a profession grounded in principles of helping people in need and challenging social injustice, right? There's a strong value for helping, which is an integral part of our profession and our personal identities. And we also in child welfare work with vulnerable families dealing with intersectional and systemic societal challenges such as racism, poverty, trauma, and substance use. Substance abuse, missed that word, but that's okay. And we also, different than nursing, right? We work with families not just for days or weeks in a medical setting, but we work with families for several months and sometimes years. And so the work that we do in child welfare and then how moral distress might show up looks different. Um, and what we found in research is that for social workers, the constraints that we feel violate not just the professional ethics of a social work, but also for many people, it violates the personal values for helping others. And then we think that it is really more distinct than moral distress in social workers and child welfare workers, is that we feel more keenly because of our values for helping both professionally and personal values for helping others, which then contributes to greater psychological distress. So moral distress is felt more keenly for social workers. And we looked at a theory of, so they're a little technical for you all students, right? So looking at moral distress, we really hypothesized and talked I looked at data from focus groups looking at moral distress. And we found, this is talking to child welfare workers and supervisors. And we found that a violation of then our values really creates a building up of moral distress. And what happens when that moral distress builds up can be two different pathways. One is workers feeling that they have to check out or sometimes abandon their values in order to protect themselves from this ongoing feelings of constraints, not letting them do the work they want to do to help families. And the other side we talked about earlier is that they reach a breaking point in which then they quit the profession as a way to really decrease feelings of moral distress and psychological imbalance and feelings of guilt. And so this is how we've done and looked at moral distress within child welfare. So I want to go on to the next topic of from understanding moral distress, because many of you, if you're, could be the first time you're hearing moral distress, but you might have also heard about moral injury. And so the difference between moral distress and moral injury is that moral injury comes from research with veterans and those coming back from combat or returning to civilian life. And so moral injury comes and derives from a morally injurious event. So engaging in or witnessing a very morally transgressive action, like being someone who drops a bomb on a civilian area by accident or on purpose, right? Because they were told that they had to do it and taking lives. So violates their values from human life. And moral injury is about a deep violation of core beliefs, feeling betrayed by leaders or those in positions of power. It's also associated with feelings of guilt and shame, but it is long lasting. Feelings of guilt and shame is high impact and a spiritual harm, right? And so while many child welfare workers do also experience moral injury, moral distress more so talks about not these big high impact actions or events, but really about the daily constraints that are felt in the everyday work of social workers and child welfare workers. And so I choose to study moral distress in my research because I feel like these are the everyday things that our workers and our students also feel when they're working with families. And it's also different than from moral dilemma, right? Which is like, I don't know what to do, right? So moral distress is, I do know what to do and what should be done. I can't do it because of these constraints. So hopefully that helps you understand the different terms around moral distress, moral dilemma, and moral injury in the work that you do. So next steps, right? We're social workers. We're going to think about like, what do we do about this, right? So the first thing is right now, there really isn't a lot of prevention or interventions around moral distress for social work and child welfare. There is some in nursing, which mostly involves education about moral distress. So that is also for us an approach. So first, talk about it. You can share this micro learning. In the next slide, I'll share one pager that you can read about moral distress that you can bring to supervision. I have a podcast on it, which I'll give resources for, and also a talk where I did and talk more deeply about moral distress. So first of all, share information around it, and also talk about it with your peers, bring it to supervision, or if you're a supervisor, talk about it with your supervisees, right? Because for me, when I first learned about it, it just gave a definition for feelings I've been having that I never had words to describe or a way to define it. So having a shared language around it was really helpful. So first, in moral distress, talk about it. The next is get some coaching around it, right? Get some coaching around what do you do when you're experiencing moral distress. Ask for it in professional development and training so that there's a, like I said, a commonality and a shared language in your agency, your workplace around feelings of moral distress, so we can help each other figure out what is happening with what we're feeling, right? And how do we then collectively, to the third bullet point, advocacy and policy change, which is how do we then advocate for policies and practices where we work that change and address the root causes of these constraints. If it's not enough time to spend with families, the root causes around court mandates that our families can't meet, right? Resources, policies that are oppressive, right? How do we then advocate together around moral distress or addressing moral distress, right? And so here I include a one pager. You might have to blow it up on your screen to download it. And you can always email me for it around moral distress. It summarizes an article we wrote about it. Here's a link to a podcast I did around moral distress, and there's a talk that I did. And so that is ending this micro learning around moral distress. And ultimately, I really want to end with thanking you all for all that you do for families, all that you want to do, but sometimes you feel that you can't because of constraints. So let's work together to figure out how we can support you to do the work you want to and need to for families. Thanks so much.